Okay, so moving swiftly on to case 3, we have 70-year-old man, previous history of depression, presented with severe episodes of lightheadedness, dizziness, and shortness of breath in response to noises in his head. Really very, very very curious case. So this gentleman is presenting with severe dizziness on waking up in the morning when he stands up from bed, and then the dizziness and lightheadedness will be then associated with shortness of breath and feeling that he's going to die as a result of noise disrupt, how can I say it, some auditory experiences in his head. So for example, when he uses an electric brush or even a normal toothbrush, the noises from brushing his teeth will go inside his brain and become more exaggerated and more rhythmic even after he stops this activity. And that will cause the dizziness to get worse, and he will have these really panic-like symptoms of shortness of breath, inability to breathe, calling the paramedics, and just generally very unwell. So he has been investigated by the ENT, by the neurology. He has right-sided sensory neuronal hearing loss, and the MRI showed some moderate small vessel disease, but otherwise normal. And his symptoms were thought to be psychological. So I went there. We did an ACE as well, just to exclude any other memory problems, because he did report some memory problems. His ACE score was 84, so mild cognitive difficulties. Just to make things more complicated, he has a sleep apnea, could not tolerate CPAP machine, but he had another sleep study and they didn't feel that he needs a CPAP machine. What I did is that I thought, okay, let's switch quetiapine to mirtazapine to reinforce the effect of the venlafaxine and maybe reduce the tiredness and sedation that he was experiencing. And instead of making any good to him, he developed this taste disturbance as a result of mirtazapine, dysgeusia. Don't know if I'm pronouncing right, but he reported that since starting mirtazapine, everything he eats feels like a rubber. When he chew or eat meat, for example, it feels like rubber. There's absolutely no taste. So we stopped the mirtazapine, and this has improved. Okay, so what is going on in this patient? So you have dizziness, and then you have symptoms of panic disorder or panic attacks, and everything else is normal. Blood pressure is normal, heart is normal, neurology say it's normal. So what's going on? So the diagnosis is hyperventilation syndrome. And if you read the criteria for diagnosis, they definitely really describe the condition of this patient. So excessive breathing when he's anxious. So when the dizziness comes, he becomes more anxious, and then he has the hyperventilation symptoms, and then dyspnea and anxiety and reduction of the PCO2. And guess what? He is breathing now into a paper bag, and these attacks are much less severe. So definitely this was hyperventilation syndrome. And the dizziness can be explained by this condition, persistent postural perceptual dizziness. Again, functional psychosomatic illness in which the patient feels extremely dizzy when changing movement. So this was a psychosomatic kind of condition, but it was too complex, and it really required the input from, as I said, sleep clinic, respiratory team, ENT, and also the neurology and the hearing therapy.